It's bizarre. This is Kafka. This is, it's... words fail.
So one of the ways that they push this is that they say that our poor populations can't afford to take care of their teeth, and so we need to put this into the water in order to protect our poor people. What's your argument against that?
Well, that's a very attractive and emotional argument, and certainly would have persuaded me before I knew the literature. The trouble with that argument is it is precisely poor families that cannot afford to avoid fluoride if they don't want it. They can't afford bottled water or reverse osmosis equipment, so they're trapped. You've trapped one section of your community, the people that are low income. The second thing, which is even more serious, is it's well established from studies done in India that the people that are most sensitive to fluoride's toxicity are people with poor nutrition. And where are you going to find poor nutrition today in North America? Answer, in families of low income. So you've trapped them, and it's going to be worse for them. And this showed up very, very early indeed, very early. In the first trial of fluoridation in the United States, they found that black children, which in those days, 1945, would have corresponded very closely to poor, low-income families, they were much more sensitive to getting dental fluorosis than the white children.
Okay. We're going to take a quick break, and then we're going to come back and speak with Dr. Paul Connet. Stay with CKUT. It is currently 8:27.
It looks very much like a fight that has lasted decades in Montreal is about to come to an end. That city is on the verge of becoming the last in Canada to have its water treated with fluoride. While most Canadians have taken the benefits of fluoride for granted, less tooth decay, lower dental bills, a strong anti-fluoride lobby led by former Mayor Jean Drapeau has kept up a 20-year fight against the chemical. Now, as Lynn Glazier reports from Montreal, the new civic administration there is preparing to end the ban on fluoridation.
Minutes ago, Régent Beauchemin jumped willingly into the dentist's chair. Now he's squirming with fright. One hand clutches his mother, the other grasps a hand mirror. He watches nervously as the drill bores into two of his molars.
Okay.
Okay. A local anesthetic, 2 fillings. That's not so bad for Régent. 4 years ago, his front teeth were so rotten with decay, he had to have them reconstructed in an operation. Régent is only 6 years old. His story is the rule, not the exception, at the dental clinic of the Montreal Children's Hospital. The waiting room is crowded with bright-faced kids, but their smiles are dotted with stainless steel caps and missing teeth. The dentists here see the worst cases. They treat 30,000 kids with severe tooth decay every year. Quebecers have twice as many cavities as other North American children. Some say it's because kids here go for Vachon cakes more than sugarless gum. Others say the cavity rate is high because the drinking water in Montreal and most other places in Quebec isn't fluoridated. Dr. Schwartz blames both. She's the head of pediatric dentistry at McGill University, and she's Régent's dentist. After 25 years of watching the fluoridation debate in Montreal, Dr. Schwartz is fed up.
You don't need fluoride, never, ever, if you would follow all the rules. An impeccable oral hygiene, always remove all the dental plaque, and a very sensible diet. Again, you don't need it at all. You even don't need any supplement from that point of view. But is that realistic? No, it's not going to work.
Okay. That was a piece off the CBC from 1988. Pushing fluoride, and you can tell the way that they did that. They show the screams and the horror of pain of going to the dentist, and obviously the media does play a role in this process of trying to fluoridate the water. What's your reaction to that?
Well, first of all, the role they play is not doing their homework. they just take one side, and they take the official side, the health department officials and so on, without recognizing that these people are biased, that they've been promoting this practice for years and years and years, without scrutinizing the data, without exercising due diligence on the health effects. But, what's interesting is they said, oh, well, Montreal is the last city in Canada that hasn't fluoridated. Let's catch up with the crowd. What they didn't say is most countries in the world do not fluoridate their water. Practically the whole of Europe does not fluoridate its water, including France. And yet their teeth, according to World Health Organization data, is just as good, if not better, than the countries that do fluoridate. They should tell that to people, not just say X number of cities in Canada fluoridate, Montreal's the last one, blah, blah, blah. This is silly. It's public relations, but it doesn't relate to reality.
And those people live longer, right? People in France live longer. We don't know if it's red wine or not fluoridation, but those people do live longer.
Yeah, that's right. And another thing, too, of course, is that the kind of conditions that they were treating in that hospital are very regrettable, have nothing to do with fluoride. You cannot, the abuse of teeth, which leads to that kind of surgical treatment, is not alleviated by fluoride. In fact, you can get the same stories today of children getting extractions in clinics and hospitals in cities which have been fluoridated for over 20 years. This condition is caused by poverty more than lack of fluoride. There's a much stronger relationship between poverty and tooth decay than you'll ever find with fluoride.
And I have an article just from April of this year, and it says Canadian government questions value of fluoridation. And there's a Dr. David Locker from the University of Toronto who is reporting that no Canadian studies provide evidence that water fluoridation is effective in reducing tooth decay in contemporary child populations.
Are they absolutely correct?
Are they not listening to the people? I mean, there's actually I received an email. I joined your email bulletin list,
yeah.
And I received an email, and one of the stories was 2 out of 2 dentists disagree with this process. Are dentists in agreement that this is a bad process, and they're not standing up and saying, hey, this is wrong, let's stop this? I mean, this is not an FDA approved process, obviously.
Yeah.
What does it take to get people? If the dentists disagree with the process, it's not an FDA approved process. Where's the disconnection between government and everybody else?
Well, I think the disconnection is that this is what we're seeing is people protecting a policy, and professional organizations like the Canadian Dental Association, the American Dental Association, protecting their rear ends. The loss of credibility on this issue is going to be enormous, and the fact they're concerned about liabilities. They've been endorsing for years dental products with fluoride in it. Don't forget that fluoride's benefits are topical. They don't work from the inside of the body. You don't put it into water for people to ingest. That's the key argument here. But in addition to David Locker, who incidentally said, reviewing the literature, he found little evidence that fluoride was reducing tooth decay any more in fluoridated communities than non-fluoridated communities, which is absolutely correct, by the way. Secondly, you've got Dr. Hardy Limeback, the former president of the Canadian Dental Canadian Association for Dental Research. He was once a strong supporter of fluoridation. Now he rejects it. In fact, he was part of that National Research Council review of fluoride's toxicity. And I'll give you a quote from the American Dental Association, which will give you a flavor of why we should be cautious of dentists and saying that it's fine, it's hunky-dory, the ones which go along with the crowd, that is. In 1979, an ADA paper, white paper, said to dentists do not need to be familiar the research literature, and they spelt out what that was, to be effective promoters of fluoridation. And failure to do so, failure to promote fluoridation, is an overt neglect of professional responsibility. So this is a bizarre again, because here you have a professional organization saying to its professionals, you don't have to be on top of a topic to promote it. And if you don't promote it, even though you may not be on top of it, you are not being a professional. You're neglecting your professional duty. Now, that kind of attitude is absolutely extraordinary. Apply it to a different field. To apply it to medicine, you don't have to be on top, doctor, of the literature on the drugs that you're giving out or the health effects that you're treating to do this. To use this drug. I mean, it's preposterous.